Hello, Aaron. How are you?
Good morning. How are you, Alon?
Good, good. For some reason, you carry my name.
Oh, look at that. I do.
Yeah,
I'm proud
yeah.
to do that.
You're just a prettier version than me.
I'll take it. Thank you very much.
Okay, so we are live, I think, with many participants that joined us.
Good morning, everyone. And the crowd goes, I can't
It's
see
really
any of the
fun.
crowd, so I'm playing the crowd as well. We got to wake everybody up here in Los Angeles, but what is it? It's like 9 o'clock in Israel or something.
Exactly.
So we got to keep everybody awake in Israel because everybody's had dinner, and they're expecting one of the NeuroSense meetings, but we're shaking it up today.
Great. I think that they are joining us from all over the globe.
Oh,
So
that's
the
fantastic.
participant that registered all over the United States, Canada, other countries, Israel, of course, Europe, many other countries.
Wonderful. Sorry for anyone who does not speak English. I can't help.
Okay, I'll do my best to match.
Nice.
So, Aaron, it's your podcast, and you're hosting me, and I'm thankful for that, and I'm honored for that, and I want to thank our participants for joining. And I'll just say a few words about you, if I may. Okay, I written it down, so I'll read from my
All right.
papers.
I'm scared, but okay.
Okay, so again, honored to participate, Aaron, in your podcast. And Aaron Lazar is a Broadway television and film star whose career included 11 Broadway productions, acclaimed TV roles, including Amazon's new series, The Countdown with Eric Dane, and appearances in major films like, and I watched this one, The Wolf of Wall Street. You did great. And Everything Everywhere All at Once. I'm not familiar with that, but I'll make sure to catch up. Aaron is a Grammy-nominated recording artist for his debut album, The Impossible Dream, and his life took a profound turn when he was diagnosed with ALS 3.5 years ago. Aaron, we are here for you. Since then, Aaron has become a sought-after keynote speaker, a passionate advocate for ALS awareness, and thank you for that, Aaron. Your voice means a lot to so many people in our community. And the creator also and host of the upcoming podcast, The Impossible Dream, launching this fall, actually launching today, where he and his guests, including myself, will inspire, hopefully, and empower us all to know that nothing is impossible.
Thank you. That was a beautiful introduction. Thank you, Alon. Look, I'm just really honored to be here. Alon is a very, very special human. I've been dealing with ALS for the last 4+ years, officially diagnosed, as he said, 3.5 years ago. I've met a lot of people in the ALS community, doctors, researchers, biotech folks, patients, nonprofits, care support. Alon is one of the best humans that I've met. And what he is doing and what you are all doing is very difficult. And so, I have been traveling the country for the last couple of years with a speaking platform that's called The Impossible Dream. And maybe, Alon, if it's good for you, I'll just share a little bit of that story with everyone who's listening.
Absolutely.
Just a couple minutes. It won't be anything too long, but we'll kind of set the stage for what the reason why I'm here, which is really because it takes very special people to do what we're all trying to do, which is find ways to end ALS. And it takes running up against impossible walls, things that people are going to tell you are impossible. They're going to say it's not possible. And you have to break down those walls. You got to burst right through them, and you have to keep going. This journey for me actually started 25 years ago. I was a graduate student in Cincinnati at an elite conservatory called Cincinnati College Conservatory of Music, and I was on stage in the dark. and I was waiting for the curtain to rise on the opening night of a musical called The Man of La Mancha. I was very nervous because I was playing the lead, a character named Don Quixote, a legendary knight on a quest to better the world through unwavering idealism. And I was nervous because there were agents and critics from New York in the audience. And so my childhood dream of becoming a professional actor was on the line. This was my chance. This was my chance to prove to my parents, who, God bless them, supported me, that choosing musical theater over medical school was the right call. This is my chance to prove that I've got what it takes to be one of the 5% of actors who could actually make a living and beat the odds. This is my chance to prove that I could make it on Broadway. And so adrenaline's pumping, right? And the show starts, and it's going really well. And then I get to the big 11 o'clock number. To dream the impossible dream, to fight the unbeatable foe, to bear with unbearable sorrow, to run where the brave dare not go, to right the unrightable wrong, to love pure and chaste from afar, to try when your arms are too weary, to reach the unreachable star. And the song ends, and I'm standing there in the spotlight, and I'm waiting. I don't know what's about to happen, when suddenly the audience rises in applause, and the show stops. And I just start to cry, because I realized in that moment that my impossible dream was coming true. But I had no idea what impossible really meant. Obviously, in the time since, I've learned. And so I'm here today to, share a little of my story, help Alon share your story with all of you, update you as to where you all are. And at best, right, hopefully we help each other, we inspire each other, and we keep each other. You guys and what you're doing, you help patients like me keep living our impossible dreams, and I'm here to help you guys keep living yours.
Thank you. So, Aaron, I'll start with a few questions that I prepared in advance.
Okay. Yeah, let's do it.
So you kind of already provided some of the answers to this one, but maybe you can a little bit elaborate. When did this start for you? When? How?
I was just sitting in my room about a little over 4 years ago, and I just looked down and noticed that my legs were twitching, my leg muscles were twitching. So I Googled it, ALS came up immediately, started seeing neurologists who did an EMG and told me I had benign fasciculation cramp syndrome and that it would not turn into ALS. And then 6 months later, I had foot drop, and they told me I had ALS. Well, it actually took about 9 months to get to that point. So, got me very interested in trying to understand how are you giving patients a diagnosis of something and saying it's not going to be the thing, and then it becomes the thing, which, benign fasciculation cramp syndrome does not turn into ALS. Obviously, I had ALS, but they weren't able to diagnose it because diagnostic tools were not, and still are not, able. So there's this lag, unfortunately, between when people start experiencing symptoms and when they're actually able to get diagnosed.
The moment the neurologist told you, okay, it's ALS, it is ALS. Tell us about this moment.
It's just, you know, I had lived in so much fear up to that point, for 9 months of terror of not knowing what I had, and anxiety and insomnia and depression and muscle twitches and weight loss and muscle thinning, and just didn't know what was happening to me. The diagnosis, you know, it was terrible for a couple days. I was actually in rehearsal for a show in New York, and I told, you know, my co-star and the director, and I told my parents, and I didn't really tell anybody else. After I cried it out for a couple days, I made a pretty quick decision to get out of being a victim. Life happens, things happen, adversity happens, challenges happen. And if you sit around and you go, I can't, what am I going to do? And you become a victim, you have no power. And so I knew I had to try and find my way out of this. I'd work with my doctors, of course. They didn't have very much to offer me. Sporadic ALS, non-genetic, not many options. At the time, actually, there weren't even many. Tofersen, I don't even think. Maybe it was just starting to become available for SOD1. But I just decided I was going to figure out how to heal myself. And I took that kind of impossible circumstance and I turned it into an opportunity to make of it the best that I could.
A life mission, obviously.
Well,
Definitely life mission.
yeah, I mean, but I didn't know that at the time. You know, at the time it was just like, I'm not going to live in fear. How do I find my way around this, into it, look for answers? And I think I've done something which is hard for a lot of people to do. I've taken responsibility and accountability for my life. I've looked back at my life. I've done a deep dive to know myself, right? This famous philosopher quote of know thyself. A lot of the answers we seek are within. We like to blame other people. We like to look outside of ourselves. But I just went within. And I started reading books on healing and neuroscience and the nervous system. And I started to develop something that would become my life's mission. I didn't know that the Impossible Dream, the song, would come back into my life, you know, after 25 years and become the anthem of my life. I didn't know that it would become an album. I didn't know it would become a speaking platform. I didn't know it would become a podcast. I had absolutely no plan to ever be talking to someone like you know, and the people who are watching. But here I am, and it's bigger than me. And I'm grateful for an opportunity as I continue to heal myself. You know, we really do heal each other. It takes a village.
Absolutely. And you are inspiring, and that fuels us, gives us it continues the motivation, the high motivation that we have to continue and advance and progress as fast as possible.
Thank you.
I know that you have two beautiful kids. You showed me their photos when I visited you. Tell me about them, how they handle it.
Well, I didn't discuss it with them for about a year and a half. I was on a mission to just handle it. I didn't want them to live life in fear. I realized I had spent so much of my life, way before symptoms of ALS, I had spent so much of my life living in a lack of self-love, a lack of self-worth, and really catastrophizing the future as an actor. A lot of pressure to do more, get more, be more, Broadway star, movie star, TV, whatever it was, it needed to be more. And that was a trap, that was a pattern that I wasn't aware of, and I was living that way. And as I've learned, you know, we make choices. Most of our life is a program. It's like we're a computer. By the time you're 35, 90% of who you are is you're running on autopilot. You're waking up with the same energy, you're having the same thoughts, you're doing the same behaviors, you're feeling the same feelings every day. And you can't change a problem. You can't solve a problem. Einstein, it's not me, this is Einstein. You cannot solve a problem from the same level of consciousness at which it was created. So if you want to solve a problem and you're having problems solving it, you have to elevate your consciousness. And whether that's you, individual, or we, the collective, right? So I was elevating my consciousness to find my way out of lower frequency, lower vibrational fear, sadness, and all of that before I started to realize I've learned so much. I want to share it with people, and I can't do that until I talk to my kids. So by that point, it had been a year and more than a year and a half. But I sat them down after agonizing. What do I tell them? Do I not? And I just said, this is what it is. And one of my sons, they were 9 and 11 at the time. One of my sons said, "Are you going to die?" And I said, "Not anytime soon." And they were like, "Cool." And they just ran out to play. I honestly couldn't have been more blown away. But I had established as the leader of my family the tone that I wanted to set, the journey that I wanted to go on, and my kids, as most kids I think do, they follow a good leader. And
Absolutely.
I like to say, look, I'm an actor, and actors rehearse. I had to rehearse a different life. And I asked people, what life are you rehearsing? And my kids now are, we're on this mission together, and they're also huge at this point. They're 6'3" and 6'1", 13 and 15, and incredible kids. It's been a life-changing experience for all of us.
I'm sure. And they love you, and I'm sure that your very plain answer, not anytime soon, that's all they needed to hear.
Everybody needs to hear it,
Yeah. So you've been very busy since then. Tell us about your latest.
Well, it just snowballed into something, when I told my kids, I then started speaking in people's living rooms, just conversations where, I would give kind of a TED talk with music, a little bit of what you heard. And then it became news to the Broadway media, and then People magazine, and then a record producer, and then we made the album, and then got a Grammy nomination. The single for the album actually came out a year ago. It's called "Let Your Soul Be Your Pilot." It's a duet with Josh Groban on a song that Sting wrote, and it's a beautiful. The lyrics are just exactly what my journey is, what I believe, that you've got to listen to the whispers of your soul, as opposed to all the noise that we're used to kind of being in our heads about. You got to really get quiet with yourself and hear yourself. And so that single came out a year ago. The album came out a month after that. It's called Impossible Dream. Got a Grammy nomination for Best Traditional Pop Album, which was a huge surprise and a big honor. And then while I was speaking on the road, I started to conceive of a podcast, and we now have 16 episodes of the podcast ready to launch. And it's conversations like this, but it's also conversations with Mark Cuban. It's conversations with Ben Stiller. It's not an
Ben is
ALS
also an
podcast.
advocate for the cause. Yeah, Ben also advocates a lot for ALS.
Yeah, he's on. He and his wife, I believe, are on the board of Project ALS in New York. But so it's really to change the narrative about ALS. We're all part of a story here, and we really have to rise above the collective consciousness and change the story. It takes a tremendous amount of energy to do that. It takes a tremendous amount of energy to heal. You have to stay in a surplus of energy. You have to be in a gain state, not a drain state, right? And so things like this, they help fuel my energy. They keep me in the energies of what I want to be doing, and hopefully they do the same for you guys.
Aaron, what they say about ALS, which is a rare disease. Alone we are rare, but together we are stronger.
100%.
By the way, I listened to your album. I loved it, but well, that was easy because I also like Sting and the Police and other types of music, this kind of music. So yeah, great album.
Thank you.
Yeah, that's that. These are my questions. Soon we'll receive questions from the crowd to both of us. I think that you also prepared a few questions.
Yeah. So, I'm always curious. I really don't know what it's like to be the founder of a, a biotech company. of a drug company. What has your experience been trying to take this on? But actually, maybe before we go there, I'm not sure that I've ever asked you this, but like, why ALS? Like, what got you into this?
So in 2016, it started with a chance meeting between myself and Shai Rishoni. Shai was a great advocate for ALS and also suffered from ALS. He had the disease. At the time that I met with him, he was completely paralyzed. Nevertheless, what he told me, he wrote me actually through a computer software that changed my life, obviously. I gathered the best team that I could, really a team, and we started looking for the causes of ALS, the pathological pathways that causes ALS in order to tackle them. And after thorough research that we did, we identified several targets, and then we were looking for the molecules that can actually bind to these targets and create the desired change. So eventually it came down to PrimeC, which is, by the way, a tribute to Shai. His last name, Rishoni, translates to Prime. And that's basically how we started with the preclinical and clinical studies. The beginning preclinical trials were studies that had excellent results. We were very excited about it. Then I came to Shai's home and I told him, Shai, we have a drug to develop now because we have great results from these models and we are going to call it PrimeC, also for Prime combination. It's a combination drug, and Prime you to you. And he was very excited about it. And that's how it all began.
It's beautiful. And it speaks to what I've gotten, how, we've known each other a little bit, but mostly because you're the kind of human that reached out to me. And, when you were in the United States, you came over to spend time with me. I don't know a lot of, drug company founders who are taking that kind of time with patients. Have you always been, that kind of a guy, or what is it for you that, gives you that connection to, the community?
So I think that what really impacted me or inspired me is Shai. And special people like Shai, including yourself. I'm not saying that it's all the ALS population, but definitely there are very special people there, and the people or their character arises above the disease, and it makes you want to be there with them, to meet them, to walk with them in this journey and do the best. It also fuels us with lots of energy and motivates us in order to do better and to do faster what we are doing. I love the relationships that I have with several people who have ALS. I cherish these relationships, and from time to time, people come to our office to give a talk to the team, and again, it motivates them, it motivates the team, and we all the time remember the purpose, what and why we are doing what we are doing, which is very, very important for us in order to do it in the best way we can.
It's beautiful, man. Well, there's a bunch of questions, I think, from your community. I don't know if you
I
want
think
to.
that always screening through these questions, so perhaps, perhaps he can.
Do you want me to ask them to
Yeah, there
you?
are many questions. I think that always screening through them, so maybe it's best to catch those.
Sure. All right, one of them says, can you please speak about the status of the NOCC application in Canada? And have you received feedback from Health Canada?
Yes, absolutely. So as we communicated not long ago, we had a very positive meeting with Health Canada. The idea was to get PrimeC to the Canadian market, to Canadian patients, and also other people who will have access to the drug as soon as possible. And in Canada, there is the NOCC pathway, which is built up on phase 2 studies, on successful phase 2 studies. We contacted Health Canada. They said, sure, you are welcome to start the process. They saw our results. We started the process. We held a very successful meeting with them. And then we had the meeting minutes. It took some time. This is a part of the process. And eventually, last week, we received a response letter from Health Canada, which surprised us because it was not aligned with the spirit of the meeting that we had with them. They said that we are not fully aligned with the criteria to submit an NOCC, and basically they suggested that we will submit additional data. So it is a setback. It's definitely disappointing and frustrating for us. And absolutely, after we communicated what was really looked really promising, the meeting with them, the meeting minutes, they said during the meeting that we have very compelling data and that the totality of the data looks very good or very promising. And nevertheless, we are still optimistic. We remain optimistic. It is a setback. It will take us a few months to get back to this process, submit the additional data, and that's what we intend to do. We are not giving up on that. We are going to make sure that we submit the data and continue the process because it's very important for us to get a drug accessible to as many as we can.
Thank you for the update. These are all sort of very specific, questions about the company. You indicated at some point that partnership discussions were ongoing. Are you currently negotiating any terms or agreements? And if not, when do you think you will be, and what are the barriers that might be in the way?
So indeed, we signed in December 2024, we signed a binding term sheet after a competitive process that we started with several potential partners. Eventually, the board of directors made the choice to go with one, to sign with one on a binding term sheet with one of the parties. We thought that we are very much aligned with their values, or they are aligned with our values and purpose. And we agreed, both parties agreed, that we are going to conclude a definitive agreement in the first quarter of 2025. Nevertheless, it did not happen due to an external factor. The process is quite sensitive, so I cannot elaborate on the external factor. But it involves a third party, and we had a delay with concluding the definitive agreement. Nevertheless, we are still in the process. It's important to mention that it was a binding term sheet to commercialize PrimeC in certain territories, not including Canada. Canada is not related to the binding term sheet. And now our intentions are to, of course, to conclude. I think that there is a strong mutual interest to conclude the definitive agreement. Nevertheless, it is our commitment, my commitment, to ensure that we have other options, and we re-engaged with the other partners that we were in touch in the past, and we are moving forward with them as well. So in discussions with other potential partners, just to make sure that we are not missing an option or an opportunity here with regards to that, as much as we want to conclude the current definitive agreement. Again, we remain optimistic about that. Again, I think that there is a strong mutual interest to conclude the definitive agreement sometime soon, very soon. But we maintain our options for the benefit of the company, and because we need to progress, we need to get this through a phase 3 study to make sure that PrimeC is accessible to patients. That's our goal.
Do you need to raise capital to do that? And do you need a partner to raise capital?
That's an interesting question, because if we have, or once we have a partner, so we don't need to raise capital. And therefore, our intention is not to do any raise anytime soon, but we have other financial facilities that we can tap when and if we need money in order to progress until we either sign the definitive agreement or once we want to enter into a phase 3 study, then of course we will need a large capital, and with a partnership, we won't do a raise. Without a partnership, eventually we will need to do a raise, but not anytime soon. And I want to also tell you, Aaron, and tell our crowd, to remind our crowd that in the last 2 rounds, we did it with insiders and at premium. So it's very important to remind everybody that it is our obligation, or my obligation, to ensure that we are doing the best for our shareholders, our stakeholders, and not harming any of them. So do the best for the company, but also to our shareholders that we appreciate.
There's 2 more questions I have here. What clinical, regulatory, or commercial milestones do you feel are going to drive meaningful re-rating of NeuroSense's valuation over the coming year?
So I think that once we enter a phase 3 study, and now we're in preparations for a phase 3 study, the team is doing an amazing job in progressing and making sure that we are ready to ship PrimeC to the clinical sites. We are in very good relationship and chosen our clinical centers, in communication with the FDA, working closely with the CRO, and basically preparing everything towards the initiation of the phase 3 study, which is a great driver for value. Also, the partnership, if I have to say, but once signed, and I think that there is an opportunity here, then of course it's a valuation driver. And of course, back to the NOCC, which we intend to pursue, and we intend to do everything in our power to make sure that we submit additional data as soon as possible, and we will do all the efforts to make it happen.
What about the FDA? Because they're allowing for, EAPs and compassionate use of some new drugs. Do you think you'll be able to get the FDA to have you guys be a part of that?
I think that once we start the phase 3 study, it opens a lot with regards to EAP programs, because then we can offer PrimeC to people who did not have the opportunity to join the phase 3 study. Because phase 3, any clinical trial, has an inclusion-exclusion criteria. So you want certain type of patients in order to maintain relatively homogeneity, in order to explore the drug properly in a small sample. And what we intend to do is, of course, to provide access to people who did not have the opportunity to join the clinical study.
All right, Alon, there are some questions now that have come in from the Q&A. Do you want me to pick some of those? Do you or want to do that?
I see. Well, this one is for you, Aaron. I see it now. You want to read it?
Is there data that you can share? Like, what's the latest data on PrimeC is one of the questions.
You see questions that I'm missing here, but sure. The latest on PrimeC. So as I mentioned, we are moving forward with the phase 3 study. With regards to the data, we published the data, and now we are submitting into a scientific journal the publication of our phase 2 study. And this very strong and compelling data, I think it's a great driver for everything that we are doing here, including the process in Canada, including the phase 3 trial, including the partnership. So that's what we are doing. And I want to thank also, this is a good opportunity to thank the team for making all the efforts to advance it as fast as we can. And we are also fortunate to have a drug that showed the great promise in the phase 2 study.
How soon do you think partnership realistically? And is your sort of ability to continue from a cash standpoint dependent on that partnership?
Well, I wouldn't want to commit to a certain timeline. I think that it can be very close to never happen. These are basically, it covers all the options from the very near future and to never. But again, as I said, I think that there is a strong mutual interest to conclude the definitive agreement. We are doing what we need to do in order to advance it, and we are doing what we need to do in order to advance with other potential partners just in case, because that's our obligation to the company and to people who suffer from ALS and the shareholders. So that's what we are doing.
Do you think there's any potential for PrimeC to work on Alzheimer's or Parkinson's?
Yes, very good question. So actually, we are running now a phase 2 study in Alzheimer's with 20 participants, and we are enrolling participants now. We do think because of a shared mechanism between the two diseases, ALS and Alzheimer's, when we're familiar with the shared mechanism or the shared targets, that we will be able also to affect Alzheimer's, and this is what we are doing. We are testing it now.
I think that's most people's question. I think there's a
I
question
agree.
about how do I like can you walk people through that might have, you know, someone who needs this drug? What is the process of them getting it right now versus how soon might a phase 3 happen? And how many people, once you start a phase 3, how many people will be able to get on it?
Okay, so as of now, the people that are receiving PrimeC are those who participated in the paradigm in the phase 2 study. So there are people who are now continuing on the treatment for over 3 years. New diagnosed patients, they currently the access to the treatment is not available until we initiate the phase 3 study. Once we initiate the phase 3 study, then of course we will welcome any and all potential participant to join, and we plan to enroll 300 participants into the phase 3 study. And as I mentioned, we do intend, once we initiate the study, to open also EAP, so expanded access programs, for additional people who suffer from the disease that were not able to enroll into the phase 3 study.
All right, Alon, I think, yeah, take a look, see if there's anything else.
Don't shy away from questions for you. I see here a question. How have you, sorry, it's written in an unclear way. Dialogue have you had a dialogue with other individuals with ALS, or did it help you along your road? I guess your journey. So have you had discussions with other people with ALS, and if it helped you? Are you on any therapy right now? And this is the question. Yeah.
Yeah, of course. I mean, I have friends from Australia to LA that have the disease. I hear from people all the time on my Instagram. It's Aaron Scott Lazar. People that have questions or need help or inspiration, I try and answer every single message. I'm certainly kind of doing this my way. It's not for everybody. You have to have an interest in changing yourself to change your life. If you're not interested in change, there's not much I can do, right? You have to be willing to say, here's what I need to change about myself in order to put myself and my nervous system in a healthier position, or in order to accomplish whatever impossible dream it is that you may have. You know, ALS is probably like any other adverse event in life. People have ways they want to deal with it. It's deeply personal. I respect and, you know, admire anyone and anybody who's dealing with this. It's at its best, life-changing, and at its worst, it's horrible. I'm always just there's a formula that I live by. I think it's helpful to share. It's It's a 5-point formula. Number one, it's follow your excitement and your passion as much as you can with whatever options are available to you. Number two is to do that with integrity. That means kindness and respect and love for yourself and others. Number three is to detach yourself from any assumption of or expectation of an outcome, which means, I know what my mission is. It's to heal from this. But if I sit there all day, every day, going, oh, my hand, looks like this, so that's not good. I'm so attached to the outcome of what a normal hand is and what my arms should be doing and what my shoulders should be doing that I'm then in resistance to the moment of my life, and I'm upset or I'm scared or I'm this or I'm that. And so you know what you're going after. It's the gold medal in the Olympics. It's this or that. But you don't attach yourself so much to the outcome that you're miserable if every second of every day you don't think you're getting closer to that outcome. And that's something that if people want to talk about, I'm happy to talk about that more. But point 4 is to stay in a positive state, and point 5 is to stay in this moment. And those are the things I share with people and their families that are going through this. And like I said, it's not easy. It takes practice. You have to unlearn the typical fears that humans have and the behavior and the patterns that we have to kind of become victims around terrible things like this. And you have to find your way out. And that's my way.
Aaron, that's beautiful. That's inspiring. And I think that anyone can learn from it, not just people with ALS, also people with other diseases and also healthy people and also companies, Aaron, because what you said resonates with me in terms of, I think that, what are we doing here? We are doing everything we can to make sure that we can improve people's life. That's the purpose, to improve people's life, to extend lifespan of people. And actually, again, so from time to time, we may tackle a challenge, we may have a setback, even if it's a surprising setback, but we are continuing full steam in order to make sure that everything will happen eventually, and people will have access not just to PrimeC. PrimeC is just the beginning from our standpoint. We do think about additional therapies in order to make sure that eventually ALS will be a disease that people can live with for so many years and won't decline and won't lose functionalities. And also, fortunately, we are not the only ones here battling ALS. It's many others and the community as well that is a part of it and gives us the fuel to move forward. And what you're saying about the impossible dream. So, as they say, everything is impossible until it's possible. And that's the rule. Things are impossible. Some things are impossible until they are possible. That's what moves everyone's forward, I think.
Yeah, I think I don't know what gives a lot of the people here on this call today the strength, the courage to support a new therapeutic like NeuroSense. But I'm sure that for a lot of people, it's not just about the money.
I know, I am aware of so many investors that did not invest in order to make $5, but they do it first and foremost because of our purpose, to move a good therapy forward, to ensure that people will have access. And again, we will do everything we can to make it happen. And also ALS is a challenge for the people who are battling the disease, but it's also a challenge for the people who are trying to find solutions for the disease. And until we have the ultimate solution, and the ultimate solution will be combined of several good therapies.
Yeah, and people ask me if I'm on any drugs right now. I'm not. I've tried clinical trials of stuff that it hasn't worked, so I'm looking right now for what's next. And again, you can feel free to reach out to me on social media, and we can have more of a conversation.
Yeah, I'm trying also to screen to some through the questions. Some of them repeat themselves in different versions. This is why I'm not reading. I see when is it soon, so I try to speak to it. Again, I cannot commit to a certain timeline because it's not fully dependent on us. And as I mentioned, there was again, they're talking about a partnership. There was an external factor that affected and delayed the timelines. We believe that now it's going to be resolved, and then we'll be able to advance forward and conclude what we started with regards to a definitive agreement. Let's see. How many patients plan? Okay. We mentioned 300 participants for the phase 3 study. Many of the questions repeat themselves this way, this version or another. Are we going to study MS? So currently MS is not on our pipeline. We are focusing on ALS first and foremost. Also, as I mentioned, we have the Alzheimer's program, and we did preclinical studies in Parkinson's, but currently this program is on hold because of resources. Somebody is asking here if would Aaron be a candidate for the PrimeC phase 3 study? So unfortunately, not for the phase 3 study, but actually, when we'll start an EAP, I do hope, Aaron, that you and I meet again, even though I'm not sure how it works with regards to the EAP, because I cannot bring it to you in person myself, but I'm definitely going to have a toast with you once.
Yeah, so a lot of the problems that I'm learning are, that a lot of the phase clinical trials, they don't really accept ALS patients after 2 years of after diagnosis. Some of them have different restrictions on lung capacity. It's like it's a whole system that is unfortunate. And the EAP, expanded access, early access, I forget what it stands for, or compassionate use, that gives patients like me a chance to get on stuff. The way you do that is you go to your doctor and you hassle them over and over and over and over and over and over again, so that they can contact the drug company and say, Alon, we have this patient, they really want to get on it. You have an EAP, you have compassionate use, we need to get them on it. And whatever the equivalent of the FDA is in Israel approves it, and you get on it. And in the United States, everything's 5 times more expensive. So Australia is a place where people are able to try stuff. Hopefully Israel can continue to be one of those places. But yeah, the system, it's something that I hope I am, one voice in many trying to change. The system of healthcare, at least in the United States, is challenging.
Aaron, there is something here to both. Alon and Aaron, thank you so much for what you are doing. You mentioned that there are other approaches. What other therapies excite you or seem to be taking an approach that you think makes sense?
Well, I think, like you said, it's not a one drug solution. I don't think someone's going to come up with one medicine that cures ALS. There's just too much. There's too much systematically going on, and doctors have been looking at this with billions of dollars for decades, and they're getting closer to figuring out biomarkers and genes and gene therapies. I mean, if you have a genetic form of ALS, there's antisense oligonucleotides, ASOs, gene therapies like tofersen, and they work. And they're spinal infusions once a month at your doctor, and they turn off the gene, and people are slowing down, stopping, or in some cases reversing. That's amazing. They're talking about trying to maybe see if people that don't have the gene, like me, can get on those safely. I don't know how you do that. I don't know if insurance is going to cover it. I don't know what the risks are. Lots of conversations. They've identified neurofilament as a biomarker, but it's not consistent. I know people that have ALS and their neurofilament levels are normal, which usually just means they will be very slow progressors. But in some cases, they're not.
It's not the case. Yeah, right.
It's very, they're trying to figure it out. And I think you guys have to keep going as long as you continue to be passionate and excited about what you're doing, and you can keep going with integrity, and you do it with whatever options you have in front of you, and you stay positive. What else can you do? That's what you're doing right now. That's what I'm doing, and we're all doing it in our own ways. And if there are people here today who are, inspired by this conversation, go on AI, start prompting it with a lot of good questions, and there's a lot of information that you can find. There's a lot of public databases, Answer ALS, PubMed. There's a lot of public databases that AI can scrub, and it can give you results of clinical trials, of studies. It can give you a lot of information. Obviously, it's not right 100% of the time, but it's very educational.
Thank you, Aaron. Thank you. To Alon, is PrimeC effective on all subtypes? So what we studied in our paradigm study is PrimeC on sporadic patients, although we did have a few genetic patients with SOD1 and C9orf. We see the results across the board. So of course, the study was relatively a small study, but what we see is promising data on all the types of patients, but we cannot say specifically with SOD1 or C9orf because the sample size or the number of participants was with this specific gene type was so small, so we cannot draw conclusions. Okay, I think we will soon be at the end of our session, and we agreed also to share the amazing tributes that your friends did for you, with you, The Impossible Dream. So maybe it's time to say what your friend is saying, and you know how to mimic him very well. All right, all right, all right.
All right, all right, all right. That's my McConaughey impression. Yeah, so this is the music video, the title song from the album. It was filmed in New York a year ago. There are 50 or 60 Broadway stars, Sting, some very fun people, Lin-Manuel, and everybody came together to do a We Are the World version of The Impossible Dream that, you can find this video online on YouTube. It went viral. You can share it with anybody you like, and please download the album to inspire you, remind you of our conversation today. And I thank everybody for having me. Alon, thank you so much
Thank you.
for having me here today, and for everything that you guys are working hard to do for people like me and for the ALS community. And I hope we have another conversation again soon.
Thank you very much, Aaron. I think that you inspired many of us here in this call, and I want to thank the audience, the people who joined us, and also to ask them to stay for the next 5 minutes to see the video clip. It's amazing in my view, and I of course call you after you watch it to get into YouTube, see it there, find it there, and share it with friends. It's very touchy, very emotional, and great video clip. So now I believe that our moderator will put it on. Aaron,
Thanks,
thank you.
everybody.
Thank you so much.
Thank
Thank
you.
Thank you to the crowd.
This is my quest to follow that star, no matter how hopeless, no matter how far.
To fight for the right without question or pause.
To be willing to march into hell for a heavenly cause.
And I know if I'll only be true to this glorious quest, that my heart will lie peaceful and calm when I'm laid to my rest.
And the world will be better for this. That one man, scorned and covered with scars,